Hi everyone, in this video we'll be discussing kinetics of elimination and one more thing is steady state plasma concentration. So we'll discuss what I mean by kinetics of elimination and steady state plasma concentration. So let's start our journey. First one is to understand the kinetics of elimination. So let us start kinetics of elimination. So before you understand the kinetics of elimination, it's important that you know certain terms. What is the term? The term is plasma half-life. The term is plasma half-life. Now, what do you mean by half-life? I'll give you an example. Suppose you give 500 mg of the drug and this drug became 250 milligram within 2 hours. Now, what is the half-life of the drug? Half-life is nothing but how much time is required to make the drug to its 50% of original concentration. So how much it was? 500. It became 250. How much time is required? Is 2 hours. So the half-life is 2 hours for this example. That is the plasma half-life. Now, let me give an example. 8 milligram of the drug becomes 6 milligram in 2 hours and 6 milligram becomes 4 milligram of the drug in 2 hours. Drug X. This is the drug X. Can you tell me what is the half-life of the drug now? What is the half-life for this example? Yes, if you are telling 4 hours, correct. So 8 should become 4. That is, it has to become 50% of its original value. So the half-life of this drug X is 4 hours. That is 2 hour plus 2 hour. So I told you the example is it has to become 50% of its original value. So that is a half-life. Now once you know the half-life, there is one more concept you all should know, and that is called elimination rate. So that is called elimination rate, or we call it as rate of elimination. Both are same. Elimination rate is nothing but amount of drug eliminated in unit time. Amount of drug eliminated in unit time is called elimination rate. So in given time, how much is eliminated? So amount is expressed in milligram and time is expressed in hour. So it is expressed in milligram per hour. That is called elimination rate. Clear? Yes. One more concept you need to understand is clearance. I told you clearance is nothing but GFR. Now, how do you express GFR? It is ml per minute. So what do you mean by drug clearance? Drug clearance is nothing but volume of plasma cleared of drug. So what is the volume of plasma cleared of drug in unit time? So in given time, what is the volume of plasma cleared of the drug? So it is written like volume is liter and unit of time is liter per hour. I told you it is similar to GFR. What is the value for GFR? GFR is given as ml per minute. So ml is the volume, milliliter, minute is the time. So here we are expressing it as liter per hour. One more formula you have to keep in your mind. Clearance is also given by elimination rate divided by plasma concentration. So please mark this. Clearance is also given by elimination rate divided by plasma concentration. Now what is the unit of elimination rate? You can take from here. It is milligram per hour. What is the unit of plasma concentration? You know it. We have discussed in volume of distribution. It is milligram per liter. Now again milligram cancels and you get liter per hour. The same unit what you have here, we got that. So that is clearance. So currently we know half-life, we know elimination rate, and we know clearance concept. Right? So once we know this, remember when you write clearance is a sum total of different clearances. For example, clearance is equal to renal clearance plus hepatic clearance plus other routes of clearance. So it's a total of all the clearances taken into one point. So all are to be added. Very good. With that basics, I can start making you understand kinetics of elimination. Let us start our journey. So, kinetics of elimination. Now, basically, there are two types of elimination process. One is called the first order elimination, and the other one is called the zero order. It is called zero order. Sir, what do you mean by that? Now, we need to throw the drug out of the body, that is elimination. Now, what do we require? We require metabolism as well as excretion part. Now, let me take an example. Suppose if I give 100 drugs, I should have 100 enzymes to metabolize this. So, I am in order. Suppose if I give 200 drugs, I have 200 enzymes to metabolize. Very good. If I give 300 drugs, I have 300 enzymes. So, no problem. How much ever you increase the drug concentration, I have the enzymes to metabolize. No problem. But what happened in zero order kinetics? If I give 80 drugs, it has 80 enzymes. If I give 100 drugs, it has 100 enzymes to metabolize. But what happens later? If you increase the dose further, if you give 200, it has only 100 enzymes. If you give 300, it still has only 100 enzymes. So what happens here? There are limited enzymes, so the enzymes get saturated. Now what happens if the enzymes get saturated? The drug level increases. The drug is not cleared out of the body. So if it is not cleared out, what happens? Clearance decreases. So it is not in order. Let me take a situation of COVID-19. Suppose 100 patient come, I have 100 bed. 200 patient comes, I have 200 bed. 300 patient, 300 beds. I can manage. But imagine that 80 patient comes, I have 80 beds, fine. 100 patient, 100 beds, fine. If 200 patient comes, I have only 100 bed. 300 patient comes, I have only 100 bed. So my hospital is saturated. So that is called zero order. Now zero order is also called as mixed order. It is also called as mixed order kinetics. Why? Because initially it was following first order. So you are in order 80 enzymes, 100 enzymes. But as you increase the dose of the drug, the metabolism or elimination shifted to zero order. That's why it is called mixed order. It is also called as saturation kinetics. Why it is called saturation? Because the enzymes got saturated. And that's why the drug is not metabolized. So the name for zero order is mixed order. It is also called as saturation kinetics. So there is some capacity limitation for zero order. Okay, sir, fine. Now first order means, remember this point, first stands for constant fraction of drug eliminated in unit time. Constant fraction of drug eliminated in unit time. Eliminated in unit time is called as first order. You can remember by the first and fraction, both start with F. Now coming to this part, zero order, constant amount is eliminated in unit time. Eliminated in unit time. Fine, sir. Okay. So zero order, it is amount, and first order, it is fraction. Okay, fine. Sir, you taught us half-life and all. You taught us elimination rate. Remember, elimination rate ER is directly proportional to plasma concentration. That means if you increase the plasma concentration, the elimination rate also increases. That's what happened here. If I increase the dose of the drug, the enzymes are also more and elimination is also more. No problem. But what happened in zero order? If I increase the drug concentration, the enzymes are saturated. Once the enzymes are saturated, can I eliminate the drug more? No. So elimination rate will not change. Elimination rate is constant. Elimination rate is constant. What about half-life, sir? Half-life is same here. Half-life and CL stands for clearance are same here. Sir, what happens to half-life here? Half-life and clearance are variable. They are not same in zero order. Please remember, in zero order, half-life and clearance are variable. I will explain that, don't worry. Write down now. Understand the basics. Now, how it is variable, sir? Half-life is directly proportional to plasma concentration. If plasma concentration is more, half-life of the drug also more. Then what happens to the clearance, sir? Clearance is inversely proportional to plasma concentration. If plasma concentration increases, clearance decreases. So first basic thing you need to remember is half-life and clearance are variable. But how variable? Directly proportional to plasma concentration is half-life. Clearance is inversely proportional. Keep that in the mind. Don't worry about that. First understand the concept. First know these things. Sir, we understood that. Okay, elimination rate, half-life, clearance. Okay, sir, fine. Who follow first order, sir? Most drugs follow that. Most drugs follow that. Then what is the example for zero order? Who follows zero order? There are only few drugs. And the name you can remember by the mnemonic, and that is called watt power. The mnemonic is watt power. Sir, what is W for? Warfarin. W for warfarin. Then what is A for? A for aspirin. Aspirin. And one more A is alcohol. Now remember, alcohol is the only one which follows pure zero order kinetics. Pure zero order kinetics, alcohol. Others are going to follow mixed order kinetics. Then T for theophylline. And another T for tolbutamide. And P for phenytoin. So I will be asking these points again and again in general pharma. The mnemonic is watt power. Watt power, W for warfarin, aspirin, alcohol, theophylline, tolbutamide, phenytoin. Now what do you mean by that? Now what happens if I use phenytoin? Normal dose, no problem, because we have so many enzymes to metabolize. Suppose I increase the dose of phenytoin a bit, then what happens? The phenytoin level increases, the drug accumulates, toxicity occurs. So these drugs you should be very careful when you are changing the dose. That's the meaning of understanding zero order kinetics. Okay, sir, we understand. Let us summarize the things. Let us summarize the thing. First order kinetics, what are constant? Let me tell you. What remains the same? Fraction is same, half-life is same, then clearance is same. Now what is variable, sir? Elimination rate. How variable, sir? More the plasma concentration, more is the elimination rate. Correct. Who follows this? Most drugs, sir. Very good. Come to zero order. What is constant here? Elimination rate is constant. How much ever you give the drug, I will do this job only. I will eliminate this much only. So elimination rate is constant. Half-life and clearance are variable. How variable, sir? If I increase the plasma concentration, half-life also increases. So T half and plasma concentration are directly proportional. What about clearance, sir? Their plasma concentration and clearance are inversely proportional. And who follows that? Watt power drugs. Now why should I study this? Because these watt power drugs, if I increase their dose, there is a chance they can accumulate, they can increase their level and can cause toxicity. So very careful when I am using this drug. Okay, sir, fine. Okay, so you may ask a question, sir, can you give some examples for this first order and zero order? Let me give the example for first order. Now, if a drug follows first order, what happens and how do we come to the conclusion? Let me give it. Suppose I am giving the drug 8 milligram. 8 milligram becomes 4 milligram in 1 hour. And 4 milligram becomes 2 milligram in 1 hour. And 2 milligram becomes 1 milligram in 1 hour. Now, if you see these equations, can you tell me every hour what is the fraction? It is reducing by half, half, half. So, in first order kinetics, what is constant? Fraction of drug eliminated is constant. Okay, fine, sir. Now, the next important thing is what about the elimination rate? What is the elimination rate? Now, remember how much is going out here? It is 4 milligram is going out in hour. So that is called elimination rate. Here, how much is going out? 2 milligram per hour. So out of 4, you are remaining 2. How much is going out? 2 milligram. Again here, how much? It is 1 milligram per hour. So this is the elimination rate. So every hour, how much is going out? It is 4, this is 2, and this is 1. The question here is the elimination rate same? No. Elimination rate is variable. How variable? If more the drug concentration, the elimination rate is also more. If the drug concentration is low, the elimination rate is also low. So it is variable. The next important thing is clearance. So what do you mean by clearance? Clearance, we have told the formula. Clearance is equal to elimination rate divided by plasma concentration. So already we have elimination rate. For that you add the plasma concentration. Here for this example it is 8. For the next example you have to divide it by 4. For the next example you have to divide it by 2. So what is the clearance now? So 4 by 8 is half, that is around 0.5. Then again half, it's around 0.5. Again it is half, that is 0.5. So clearance in every example is same. So clearance remains same in first order kinetics. What about the half-life, sir? From 8 to become 4, what is the half-life? 1 hour. From 4 to become 2, what is the half-life? 1 hour. And from 2 to 1, how much is the half-life? 1 hour. So what happens to the half-life? It is same. What happens to clearance? It is same. But what is variable is elimination rate. What is variable is elimination rate. How variable? More the plasma concentration, more the elimination rate. So that's the example for it. Sir, can you give an example for zero order kinetics? Let me give that example for zero order. For zero order, let me take the same 8 milligram. So 8 milligram will become 6 milligram in 1 hour, and 6 milligram will become 4 milligram in 1 hour, and 4 will become 2 milligram in 1 hour. Now every hour, what is the amount going out? You can see 8 becoming 2, how much is going out? 2 milligram. Here it is 2 milligram, here it is 2 milligram. So how much ever you give the drug, the elimination rate remains sustained. So constant amount is going out. Every hour you can see unit time, every hour how much is going out? 2 milligram, 2 milligram, 2 milligram. That's why the amount is constant. So in zero order, constant amount of drug is going out. And if you see the elimination rate, it is 2 milligram per hour. Whatever the drug concentration increases, the elimination rate remains the same. Same, no, nothing changes. Okay, sir. Sir, once I know that, what about the clearance, sir? Clearance is nothing but, we have done that for already, divided by 8, divide this by 6, and divide this by 4. Now tell me the elimination rate. This is 1 by 4, that is around 0.25. This is 1 by 3, it's around 0.3. And this is 1 by 2, around 0.5. So clearance, you can see here guys, clearance is not same. Clearance is variable. Now how variable? If the concentration of plasma is more, the drug concentration is more, clearance is low. If it is less, clearance is high. So can I write plasma concentration is inversely proportional to clearance? They are not directly proportional. So clearance is variable. Okay. That means if you give the drug more and more, the drug accumulates and it is not going to get cleared out. Sir, what is the half-life then? Half-life is, now 8 should become 4, then only its half-life. How much? Half-life is 2 hours. Now 6 should become 3, it will take around 1.5 hours. Now 4 should become 2, it takes 1 hour, 50%. So is the half-life same? No. Half-life is also variable. How variable, sir? If I increase the drug concentration, half-life is more. If I decrease it, half-life is less. So can I write half-life is directly proportional to plasma concentration? If the drug levels are more, half-life is also more. If drug levels are less, half-life is also less. So this is the correlation, guys. So let me summarize the things, and this is just a demo for you how these are derived. Okay, first order and zero order kinetics. Okay, yeah. So first order fraction is constant. Constant fraction is eliminated. Half-life, clearance are constant. We have demonstrated that. Elimination rate is variable. How variable? More the plasma concentration, more is the elimination rate. Most of the drugs follow that. Zero order kinetics, constant amount is eliminated. Elimination rate is constant. How much ever you give, the drug eliminated is constant. The amount is constant. That what is variable? Half-life is variable, clearance is variable. That's it. Who follows that? Watt power drugs. That is about kinetics of elimination. The next thing what we need to discuss is the half-life and steady state plasma concentration. Now I already told you. So I already told you what is half-life. So half-life is written by the letter T half, and it is called as plasma half-life. What is it called as? Plasma half-life. Now, what do you mean by plasma half-life? It is nothing but what is the time required to make the drug 50%. I gave the example like this. Suppose I give 500 mg of the drug. It has to be made 250 milligram. Now, it takes 2 hours for that. And what is the half-life of the drug? Is 2 hours. So, that is the simplest meaning of that. Now, how many half-lives are required to eliminate the drug out? How many half-lives are required? Let us take the example. Suppose we give 100 molecule of the drug. How many half-lives are required? So, 100 has to become 50. To that, you require 1 half-life. 50 has to become 25, require 2 half-life. Now, 25 has to become 12.5, that is 3 half-life. Now, 12.5 has to become 6.25, you require 4 half-life. And 6.25 will become 3.125 after 5 half-life. So, clinically you want to remove the drug, eliminate how many half-lives are required? It is around 4 to 5 half-lives. Mathematically, if you take, it takes longer. So, it takes 4 to 5 half-lives. So, if they ask in the exam, how much drug remains after 3 half-life? Can you answer this question? How much drug remains after 3 half-lives? So, after 3 half-lives, the drug remaining is 12.5%. It is around 12.5%. Or if they change the question, how much drug eliminated after 3 half-lives? See the question. It looks similar. Now, how much is already thrown out of the body? Now, if it is 12.5 is remaining, how much is already thrown? So, for that, you have to take 100 minus that 12.5. So, you will get around 87.5. So, you will get around 87.5. That is the amount eliminated after 3 half-lives. So, this is how the questions can be tricky for you. This is how the question can be tricky for you. Okay. Yes. So, that is about the half-life. Now, when you know about half-life, it's important. Why should I know the half-life? There are certain calculations for half-life. Remember, half-life is equal to 0.693 divided by K. So, what is K for? K stands for elimination rate constant. K is elimination rate constant. So, one of your exam, they had given elimination rate constant and they had asked a half-life. So, they are given K value. For example, if K value is 0.693, what is the half-life? 1 hour. So, if you know this, it is easy to calculate. That is one thing. Is there any other formula for half-life? Yes, sir. Half-life is also given by 0.693 into volume of distribution divided by CL. CL stands for clearance, VD stands for volume of distribution. Again, this formula. Right. Now, remember, if volume of distribution is high, half-life is also high. If clearance is more, half-life is less. Yes or no? If drug is cleared faster, it will not remain. So, half-life is also less. So, remember this point. Remember, very, very important point. Half-life and VD and half-life and clearance. Very, very important. Now, many times during calculation, if you can't use 0.693, you can use 0.7 also as the value. Okay. Now, what is the importance of half-life? Importance of knowing half-life. Importance of half-life. Yes. Number one, half-life will tell us a dosing schedule. How many times in a day I can give? That is given by half-life. Dosing schedule. Half-life will also tell us about achieving steady state plasma concentration. Steady state plasma concentration. So let us understand the importance of dosing schedule. What do you mean by that? Half-life will tell us about dosing schedule. So what do you mean by that? The meaning is simple. Suppose a drug has a half-life of 5 minutes. Now tell me, will you give the drug every 5 minutes to the patient? Suppose we are going to give oxytocin. Oxytocin is used during starting of labor and to maintain the labor. Oxytocin works for only 5 minutes. T-half is 5 minutes. Now if the half-life is 5 minutes, should I give it every 5 minutes? No. So what I do is, if the half-life is very short, for example oxytocin, I cannot give it repeatedly. So what I give is, I give it as IV infusion. Again, another drug, its half-life is 2 minutes. Example of that drug is dopamine. The name is dopamine. So dopamine also I cannot give repeatedly, I will give it as infusion. Suppose the half-life of a drug is 2 hours. Now let me give a classical example for this. The half-life of paracetamol is 2 hours. So do you think I have to give the paracetamol every 2 hours? Patient will not take it. So what we do is, if the half-life is between 2 to 4 hours, we try to increase the duration of action. How do we do that? By increasing the dose, we double the doses. So by doing that, we can give the drugs 6th hourly. We can give the drug 6th hourly means 4 times a day. 4 times a day. And that's the reason even the paracetamol is having a half-life of 2 hours. We are doubling the dose and we are adjusting the dose in such a way that it is given 4 times a day. Otherwise 2 hours half-life, you cannot give it 12 times a day. Not possible. Not at all possible. So that's the point. Now, if the half-life of a drug is around 6 hours, then how many times in a day you have to give? Again, it is given as 4 times. 4 times a day. Even the half-life is 2 to 4 hours, we have to make the dose in such a way that they are given 4 times a day. Half-life is 8 hours. Then you have to give 3 times a day, because 24 divided by 8, 3 times. Half-life is 12 hours. Then we give 2 times a day or twice daily. If the half-life is 24 hours, then we can give once a day. So remember, half-life will give a rough idea for dosing schedule. It is not going to tell us duration of action. Half-life will not tell us duration of action. Remember that. It is just helping us for scheduling the dose. How many times in a day I can give. If it is very short acting, half-life 5 minutes, we have to give infusion. 2 to 4 hours, we have to increase the dose and make it to give 4 times a day. 6 hour, 4 times only. 8 hour, 3 times. And 12 hourly, 2 times. And 24 hour, it can be given once daily. So that will help in dosing schedule. That is the importance of T-half. So let us understand steady state plasma concentration. Let me write that. Steady state plasma concentration. Now, what do you mean by that steady state plasma concentration? It is nothing but rate of drug entry should be equal to rate of drug exit. So it should be equal to rate of drug exit. Meaning, if you are giving 100 drugs, so there is a point where 100 drugs is also going out. If you are giving 100 drugs are going out. Sir, why should we do that? Certain drugs you have to maintain their level within that range, steady state, then only they will work. For paracetamol, no problem, but for drugs like lithium, digoxin, you are giving for a very long period, their level should be maintained within that steady state. So how to achieve that? How do we understand this topic? To understand this topic, let me take a simple example. Now there is a bucket in your terrace. Now, in that bucket, you want to fill the water with a tap. So this is the tap through which you want to fill the water. So the water is coming from the tap. Now the problem in the bucket is the bucket has a hole. So there is a hole in the bucket. Now what is the purpose of keeping that bucket? You want to feed the birds, because in the summer you have to feed the birds. Now what happens when you put the water will fill up. And what happens? after some time the water will not remain this much level. Why you have to keep that much level? What I mentioned here, because the birds can sit and they can drink the water. But when you fill the water and go away, what happens? The water will go away, because when you put the water will slowly go away from the hole, that is eliminated. Now you should adjust that in such a way that the water always remain in this level. How do we do that? You can do that by adjusting the entry of water. So you will adjust the tap so that the entry from the tap should be equal to the exit from the bucket. So the rate of entry should be equal to rate of exit, and the water level should remain in this so that the birds can come and drink the water. You may ask a question, sir, can we put a patch there? That is practically possible. I am just taking an example. Suppose you are not able to close that. Suppose you fill the bucket with the tap only in the beginning and stop the tap. What happens? The water will go away. The water will go away. Or if you adjust the water in such a way that the exit from this is equal to the entry from this, so that always the water level remains here. So that is called the steady state. You have to maintain that level. Now same thing we have to do for the drug. So what is steady state? Steady state is nothing but rate of drug entry should be equal to rate of drug exit. Now rate of drug entry is what we mean by the rate of infusion. The rate of infusion. Now rate of infusion, you can also write it as the infusion rate, is equal to rate of drug exit is also called as elimination rate. Rate of elimination or elimination rate. So this should be equal. Then we call it as steady state plasma concentration. Now infusion rate or rate of infusion. Now what does it equal to? You know that clearance is given by elimination rate divided by plasma concentration. Can I write elimination rate is equal to clearance into plasma concentration? Yes, because this will go here. A bit of maths, but you will understand that. So can I write rate of infusion is equal to clearance into plasma concentration? These are the formulas which we'll use later. So rate of infusion is equal to clearance into plasma concentration. Yes, fine. Now another important aspect we need to derive from this is a dose called maintenance dose. Maintenance dose. So maintenance dose is equal to rate of infusion or infusion rate into dosing interval. So that is maintenance dose. So what is rate of infusion? Can I replace this with clearance and plasma concentration? Yes. It is clearance into plasma concentration into dosing interval. And that is what we mean by maintenance dose. So maintenance dose is equal to clearance into plasma concentration into dosing interval. Now sometimes if you are giving the drug, entering the drug by oral route, it will have a factor called bioavailability. So you have to divide that by F. So maintenance dose is given like this. Clearance into plasma concentration into dosing interval divided by F bioavailability. So maintenance dose depends on which parameter? It depends on clearance. Again, this is a question for it. Now when they give dosing interval, many a times you make a mistake. What is that? Suppose they are given, okay, they may give in the question, give the drug 8th hourly. Or they may give in the option, give the drug thrice daily. Now in dosing interval, will you put the thrice daily, that is 3, or will you put 8th hourly as the option? What will you use in your exam? Suppose they are given, the drug is given thrice daily, and what is the dosing interval? What value will you put? Will you put 3 or 8? You have to put the 8 value, because how many hourly we are giving, that is the one which we have to substitute there. Now many times what happens, you will try to put 3 there. If you put 3 there, you are getting a wrong answer. So if they are giving thrice daily, you have to write 8th hourly. If they have given twice daily, then what number you will put there? You have to put 12th hourly, 12 as the number. If it is given 4 times daily, then you have to write 6th hourly. So you have to substitute 6 there. Very, very important. Most of them have made mistake with that. So we understood the maintenance dose, we understood rate of infusion and rate of drug entry. So that is called steady state plasma concentration. Now, once we talked about, once we have understood about the steady state, but how do we achieve that steady state? How to achieve steady state? How to achieve steady state? Okay. Now you told, sir, rate of entry should be equal to rate of exit. So you gave an example of a bucket with a hole and the tap entry. So the entry of tap is what we mean by rate of entry. The exit from the hole is rate of elimination. How do we make it? Now you do that experiment in your home. Not possible. So you have to adjust the rate of entry and then you have to adjust the rate of exit. Then you can get the steady state. So it takes time. It takes time. It is not going to happen in 1 second or 1 minute or 1 hour. It takes some time. So to achieve steady state, you require certain time. There are 2 ways to achieve steady state: by giving intermittently, by giving the drug intermittently, or by giving continuously. So you can achieve by giving the drug intermittent or by giving continuously. Now, what do you mean by intermittently? I will not give it continuously. I will give it every half-life. I will give the drug every half-life. If I give like this, how much time does it require to achieve steady state? Let us understand that. So first of all, understand what happens in intermittent dosing. So it is called intermittent dosing and this is called continuously dosing. Let us understand that. To understand that, I have already put a graph for you. Now what does graph tell you? Whenever you see a graph, just check what is there in the x-axis. You can see the time 2, 4, 6, 8, 10, 12, 14, 16. They are time in hours. And you can see the plasma concentration of the drug 20, 40, 60, 80, 100, 120, 140, 160, 180, 200. So that's the concentration of the drug. Now you have to achieve the steady state between this. So this is the maximum and this is the minimum. So within this range, you have to achieve the steady state. So if the drug is within that period, it will work. You may ask a question, sir, if you want to achieve steady state, can we give this drug at one time? If you give the drug at one time and leave, after some time it will fall down. It is similar to what we told. You fill the bucket and leave it. After some time, all the water in the bucket will go out. So then the level comes down. Then the steady state is not achieved. So what we can do is, we can give the drug repeatedly. I have to maintain the level between these two so that the drug produces the effect. So how do we do that? I told you intermittently. And the example I have taken, this drug has a half-life of 2 hours. Now what we do is, we give the drug every 2 hours, every half-life, and see how much time is required to achieve steady state. So I have to achieve the steady state between 200 to 100. So how do we do that? Let us see. So this is the example now. Now what I did is, initially I gave the drug 100. I gave the drug 100. Now what happens in the first half-life? 100 will become 50. 100 reduced to 50. That is 50%. So what I did is, I gave another 100 to this. I gave another 100 to this. Now it became 150. Again, after another half-life, it became 50%, it is 75. So that is at the second half-life, it has become 75. For this, I added another 100. Now it became 175. 175. Again, after one half-life, it becomes 87.5. I have taken approximately 88. For this, I added another 100. So now it has become 188. So again another half-life, this 188 becomes 94. So at the end of 4 half-life, it has achieved 94. and again we added 100 to this, it becomes 194 here. Again at the end of 10 hours, that is 5 half-lives, it has become 194, and again it comes down to 97. So at this point 97, it is fluctuating between 197 and 97. So we are achieving that steady state. So the drug is between 97 and 197. Approximately we have achieved that much. So that is what we mean by clinical steady state. Suppose you want to get 100%, that takes longer time, more than 7 half-lives. Clinical steady state, that is the drug fluctuating between 100 to 200, approximately around 97 to 197. That is what we mean by clinical steady state. Now, will that occur immediately? No, it takes some time. So please remember, this takes time, and there is a midline crossing through that is called average. So it is called steady state average, and the maximum is steady state maximum, the minimum is steady state minimum, that is called trough. Trough means low level, peak means high level. So how many half-lives are required to achieve steady state? 1, 2, 3, 4, 5. Approximately 5 half-lives. At this point, how much drug is present? 97. What is the peak? 197. The drug fluctuate between this. So this is fluctuation, but in the person there is average level. So I told you in the bucket, if you fill the bucket and leave it, all the water will drain off. But when you adjust the level, so the level will be average for certain time, and when you adjust that time, and when you adjust the tap, it takes certain time. So that is why to achieve steady state you require certain time. And what is the time? It is around 4 to 5 half-lives. So how many half-lives are required to achieve steady state? It's around 4 to 5 half-lives. How many half-lives are required to achieve 50% steady state? Is 1 half-life, 75% is 2 half-life, 87.5% is 3 half-lives. So these are the questions they can ask you in the exam. Okay. So let me write that. How many half-life to achieve steady state? So clinical steady state, how much you require is around 4 to 5 half-life. Okay. Mathematical steady state, mathematically exactly you want between 100 to 100, it requires more than 7 half-life, which we don't want that. We want a clinical one, a practical one. Now, if you want to achieve 50% steady state, how many half-lives are required? 50% steady state, you require 1 half-life. That is the time required. If you want to achieve 75% steady state, how much time is required is 2 half-life. 87.5% steady state, how much you require is 3 half-life. And very commonly asked in exam, 90% steady state, how much half-life is required is 3.3 half-life. Please mark this is repeatedly asked in exam. 3.3 half-life is required for that. Okay. So let me take an example. Lithium has a half-life of 1 day. It has a half-life of 1 day. Can you tell me, lithium to achieve 50% steady state, how many days are required? 1 day. 75% 2 days. 90% 3.3 days. How many half-lives to achieve clinical steady state? 4 to 5 days. So that is the meaning of steady state. So what I demonstrate to you is intermittent administration, that is before the expiry of half-life, I am giving the drug repeatedly. So if you give like this, it takes around 4 to 5 half-lives to achieve clinical steady state. Clear? Now once we are clear with this, there is one more thing you need to understand. Sir, what happens if I give it faster? If I give very fast, will it achieve the steady state faster? Now you take the example, the bucket. If you put the water too much, do you think you will achieve the steady state faster? You may achieve, but the water will spill out. So same thing, if you are giving continuous IV infusion, continuous dosing, will the steady state achieve faster? So let me tell you this. This is the infusion. Suppose you are infusing too fast. Will you achieve it faster? Now, even if you are infusing it, it again takes 4 to 5 half-lives. Then only you will get a steady state. So it will take the same time. So this is the time required to achieve steady state. You require 4 to 5 half-lives to achieve steady state, even if you are giving continuously. For example, you are infusing it at 1 microgram per minute. Now, what if I increase the dose further? If you increase the dose further, again it takes the same time. You will achieve the steady state, but you will achieve a new steady state. That's it. You may get the infusion may be changed to 2 microgram per minute, but only thing is the graph goes up. That's it. Suppose if I infuse still too fast, again it takes the same time to achieve that. You may increase the infusion rate to 3 microgram per minute, but it takes the same time. So the time required to steady state is same whether you give it faster or if you give slower, but only thing is the rate of infusion changes, the steady state level increases. For example, I told you 100, 200, that may become 300, 400, but to achieve that it takes exactly same 4 to 5 half-lives. Very, very important. So to achieve steady state, you require 4 to 5 half-lives. Whether you give continuously or you give intermittent dosing, it takes the same time. So that is about steady state plasma concentration. Now, one more thing I just want to tell you. I had told you rate of infusion is equal to rate of infusion or infusion rate is equal to clearance into plasma concentration. Now, many times, if that is not there, clearance into steady state. If they had given steady state plasma concentration, that can also be taken into consideration and you get rate of infusion. So this is one more formula you have. Okay, so I told you about steady state plasma concentration you can achieve in one is by giving continuously or by giving intermittently. But there is one more practical issue. Suppose a drug has a half-life of 40 hours. So one of the drug which has a half-life 40 hours, example is a drug by the name digoxin. So digoxin has a half-life of 40 hours. Now, with the 40 hours half-life, how many hours are required to achieve steady state? How many hours are required to achieve steady state? It requires 40 into 5. That means around 200 hours. To achieve steady state, it requires 200 hours. Do you think in an emergency, we wait for 200 hours to achieve steady state? That is practically not possible. So what we do in that case? Will we wait for that much time? No. At that time, what we do is, let me show you the same graph. We have to maintain the level within this two. So what we do is, we give a high dose. So we give a high dose and that is called the loading dose. Now if I give the loading dose, the drug will achieve that required level, but after some time that will fall down. Again, when it falls down, the effect is not seen because if you go below this line, it will not work. So what we do is we give loading dose to get the immediate effect followed by the maintenance dose. So then we give the maintenance dose. This is another dosing strategies in case if the half-life is very long and you cannot achieve the steady state faster, we can do like this. Give loading dose followed by maintenance dose. So that will take care of this. So let me write a formula for that. So loading dose is equal to target plasma concentration, how much you require, into VD divided by, if there is viability, write F. Now maintenance dose MD is equal to how much you require, target plasma concentration into clearance into dosing interval divided by F. So these are very, very important formulas you need to keep in your mind. So loading dose depends on VD, maintenance dose depends on clearance, and depending on what concentration of drug you require in plasma, then you have to give the dose. So that is the meaning of the loading dose or maintenance dose, how we achieve steady state. So steady state usually takes time, but if it's an emergency, we cannot wait. For example, if a drug has very long half-life, then we have to give loading dose followed by maintenance dose. Okay, so that is about the kinetics of elimination, half-life, elimination rate, clearance, then first order, zero order, then how to achieve steady state, how many half-lives are required. So it requires certain time to achieve these things. So that is about these important points in this video. Thank you all.